Thank you very much, and I want to thank Leader McCarthy for putting this task force together, and in particular the Healthy Futures Task Force, and for Representative Buchanan, Representative Guthrie, thank you for your leadership through this process, and pleased to have had the opportunity through this process to work with Representative Wenstrup and Dr. Joyce as well. And I think we've come pretty far with all this. We've held roundtables. We've been out talking to stakeholders and researchers and talking to doctors. We've put out requests for information. You know, one of the things that we're trying to do through this is pretty much is a general theme, the opposite of what Democrats and Build Back Better are trying to do, where they see a one-size-fits-all approach to medicine. And we know that medicine and healthcare in general is very personal. I can remember with our doctors caucus here in the Republican side, it's about 6 years ago under the Obama administration, we had someone from CMS coming in to talk to us so we could ask them questions, and it was nice that they came. But one of the things that the representative said is, all the things that we're starting to implement are really starting to work. And we all kind of looked at each other as doctors who have come from private practice, and I know Dr. Joyce will appreciate this. And I just looked at her and I said, do you know why we're here, why we're serving in Congress now? On behalf of patients, because you've taken the joy out of taking care of patients with all the things that you say are implementing and doing so well. So we bring this experience to the table and hearing from so many people. So this task force really come together with three major goals. Lower the drug costs for Americans, unleash new innovative medicines, devices, diagnostics to treat and cure diseases. That's the bottom line. And promote American-made medicines. You know, so our goal, lower drug costs. Well, H.R. 19 is a Republican bill, but it's really full of bipartisan measures that have developed over time. There's about 36 measures in there. And some of the things that are in H.R. 19 would lower drug costs without sacrificing innovation. It would do an out-of-pocket cap for seniors. Site-neutral drug payments. Drug payments for things like in-office IV therapies, et cetera. If it's site-neutral, once it becomes part of a hospital, the price goes up. Price goes up for everyone. And we want to make sure that we can, as soon as possible, develop quality generic medications so that there's good competition out there. At the same time, protect patents of new innovations, because when we don't do that, then we lose those innovations. So that leads to the next goal, which is to unleash innovation. And the Biden administration stands in the way of a lot of these things. And a recent example is the FDA-approved Alzheimer's drug, which has its restricted windows. And whenever there's a new drug, they're always going to get better in the future. That's what we always see in medicine. But you get this FDA-approved medication, which could save so much money and obviously lead to an improved quality of life for people. And CMS decided that they're not going to cover it. Well, that makes it extremely difficult. And then also Biden pulled back the Trump-era policy to give seniors immediate access to new innovative devices approved by FDA's gold standards called the MCIT, and the Biden administration has put that on hold. And we're also seeking coverage for things like multi-cancer early detection diagnostics. You know, what we're really trying to do across the board is improve people's health span. You know, we always talk about lifespan, and we can go into detail about that, but really, how do we keep people healthier longer? I always use a reference, none of us are getting out of here alive, but let's live our lives, and let's live them well, and let's live them healthier. And the more we can do that, I think the better off we're going to be served. So another thing that concerns me is this quality adjusted life years that Democrats are talking about, which puts a value on everyone's life. And I think that's an extremely dangerous thing to do. Today, introduced a bill with Kathy McMorris Rogers and Jim Banks to ban what they call QALYs, Q-A-L-Y apostrophe S, if you will, from coverage determinations. It should not be part of that. And then lastly, promote American-made medications. You know, if you'd have told me when I was serving in Iraq as a surgeon that my protective equipment and my pharmaceuticals relied on an adversary, in particular China, I think, how did we get here? Well, we're starting to try and investigate all that and see where things come from, and we've got to do what we can to bring things back to the United States of America. As far as companies go, since the Tax Cuts and Jobs Act, there's been no inversions. People have not left the United States. Some have come here. We got to continue to go in that direction, and I believe we can do it through tax incentives for domestic manufacturing. So I'll leave it at that.